Good morning. I am Priyanjali, your host for today on ZTalk, a public awareness initiative on how we can protect our kidneys from damage and also to lead a healthy life. Because if our kidneys are damaged, we know the consequences. And if it's already damaged, we would want to know how can we have a normal life. To educate us on what's right for our kidney health, we have our expert with us, Dr. Dilip K. Pahari, currently practicing at Medical College, Calcutta. Firstly, welcome to this platform, sir. Our first question for you would be, how would anyone know if he or she has a kidney issue? Are there any common problems or common symptoms?
So, I think that's a very particular important problem because there are two issues. One is some patients can have symptoms and they can know that they might have a kidney problem, but they are only there. There are a large group of patients where there may be a kidney problem, but they don't know that there is a kidney problem. So how to detect it?
Right.
So the first is we have to see clinically the patient, whether the patient is known history of hypertension, diabetes, there is a blood pressure we can check whether there is a anemia and whether there is a swelling in the legs and so on. And the history, other things, they will some guide. But the initial screening in patients who have no symptoms at all or who may be diabetic or hypertensive but don't know whether they have a kidney disease or not. So we get the basic three tests. One is ultrasound that gives you whether you have a stone disease, whether you have polycystic kidney disease, whether kidneys are small, kidneys are large. So they give a lot of information and the urinary tract. So there it gives a lot of information. The second test we do usually urine test. So whether if you get a urine analysis, you find there is a protein in the urine, there may be blood in the urine, there may be pus cells or WBC cast, and so on. So that gives a lot of information. The third is you check the blood. Blood you can check whether the hemoglobin, they check the urea, creatinine, sodium, potassium, and so on. So with these basic tests, so one is ultrasound, second is urine analysis, and third is your blood test. Along with the clinical examination, most people will be able to know whether they have a kidney disease or not. They may have a symptoms like they may have a exertional dyspnea, so they are breathless because of they are walking, or they may have a swelling in the legs. These are the two common symptoms in patients who are unknown about their kidney disease. But other than there are a lot of other symptoms related to secondary to other diseases. For example, SLE can have a joint disease, flare up in the skin and so on. And the diabetic may have a swelling in the legs and so on.
Right. Doctor, next question for you would be a very important question again. How do you usually access whether a patient needs transplant or dialysis?
Okay. So the first, in order to know that patient needs a dialysis or transplant, we have to first ascertain that both the kidneys are damaged and irreversibly damaged. So that is the first fundamental criteria. So kidneys are damaged to the extent of 90% or more. And second is the kidneys you will not recover. So there is a irreversible damage. So this is called end-stage renal disease or stage 5 CKD. So once the patient reaches that stage, then the option is whether you can go for either dialysis or transplants. So the transplant feasibility depends on three things. One is whether they have a suitable live donor or he is willing to wait for the cadaver donor. Second is whether the family is willing for this donor or the patient is willing for the kidney transplant at all. So the default program is dialysis. Transplant is a patient has to choose that I want to do a transplant because it involves a lot of exercise, including testing, then the availability of the donor and so on, and lifelong finances. So all these are decision making, and third is the medical suitability. So we have to, as a physician, you have to choose whether the patient is suitable for transplants or not. A patient who is suitable for transplants because of his age, other comorbidities, maybe he is having cancers, maybe having heart failure, maybe have a prior stroke, what is the age, what is the, growth actually, we, very young children, born less than 10 kg, maybe say 1 month, 2 months, they may be considered unsuitable for a transplant. So the suitability of the recipient for the surgery has to be decided by the transplant physician, and exclusion of all of the comorbidity, they may be suitable or may not be suitable. Once the physician decides that the recipient is likely to be suitable, then the question comes whether he has a donor or waiting for the cadaver donor. And if that succeeds, and then the second question will be, even if after transplants, who will finance the long-term immunosuppression? So all these factors has to be taken before we consider a transplant.
Right. Well, that was a very informative talk with Dr. Dilip K. Pahari speaking on kidney health. Thank you so much, Doctor.
Thank you.
Thank you, Doctor, for your valuable advice. I'm sure all our viewers will be benefited from your advice. And viewers, do like, follow, and subscribe our ZTalk page on Facebook and YouTube. And to get more informations and right informations from renowned kidney specialists, stay connected, stay safe, and stay healthy.